So, one of the biggest things in entrepreneurship that we struggle with, or should I say that I was contemplating before I left my job, was how am we going to have insurance? Like working for the federal government, they do have good insurance. So when you're talking about your medical, your vision, your dental, your main three, it's like, okay, what are you going to do for coverage? Something happens, or your regular checkups and your maintenance. What are you going to do? And luckily, we were blessed that Chris came from a medical background when she used to work at not only the hospital, but she used to work at Walgreens as well. So she deal with a lot of processing insurance and bill pays and all that type of stuff. So she did some research on that to figure out how we can go find plans when we're independent or when we're as an entrepreneur or owning our own business, or how to go that route. So I want to let her talk a little bit about that process and how you can find coverage if you're an entrepreneur. So Chris, just tell them about some of that.
So where I started off was the marketplace. So not Facebook Marketplace, but the what is it? The healthcare marketplace. So healthcare.gov. And it's a very simple process. You're able to go through and kind of search based off of what kind of medical needs you might have, what kind of medicines you take, what kind of doctors you see, and you can kind of put the information in there. But it's a real simple process to apply. They made it very user friendly, so you're able to go in, fill out the application, and then you do need to have file taxes because they base it off of your tax documents and
Now,
estimated taxes.
when you say taxes, is that personal taxes or business taxes that they look at?
Your personal
The
taxes.
personal taxes,
Mhm.
okay.
Yep. So personal taxes, and what they do is they take, and from my understanding, they take an estimate of, what you are predicted to make, and they base it off of that about how much they're going to give you to allow a tax credit that they're able to use to apply that to pay for your health care. So whatever tax credit comes up, whatever amount, it'll give you a dollar amount, and you're able to either use all of that or some of that, and it can help offset the premiums you have to pay. So thankfully, I was able to find plans, Blue Cross Blue Shield plans that have no monthly premium, and they covered our necessary needs, and so it was a real blessing as far as that.
Now, is that something that's taxable? And this is kind of like a rhetorical question because I know it is, but I remember when we went and filed our taxes for 2024 and our CPA was like, well, I can't officially file these because there's something out there that's outstanding. And we was able to figure out because our taxable insurance, that's something that they consider. So how did that play into it? Do you know as far as that?
I don't know the specifics.
Okay.
You do have to file your taxes every year, and you have to print out, I think it's a 1095 that they give you. And so it shows like what you used, how much tax credit you used for each month of the year that you were under the insurance from the healthcare.gov. And they use that and they look at that. And I'm not sure what kind of magic goes into it, but they do that and it has to be done with your taxes. So your CPA can put that in there for you and figure out and answer more in-depth questions of what they're looking at and how they need to use that information.
Right. So do you have to have like certain amount of income on your personal taxes? Like, do you have to be like below like a poverty line to be able to qualify for the marketplace? So let's say like our business or our personal, as either sole proprietor or independent, let's say we're making, I don't know, a crazy number like $500,000 a year. Does that still play into the factor of whether we will qualify the marketplace, or it's not no dollar threshold? Did that when you was filling in the amount?
I think that there's a threshold. I'm not sure what it is, and I think that what happens is that the more you make, the less they may give you towards your monthly premium. I could be wrong.
You're right. And once again, understanding what she's talking about, personal taxes. So let's say your business account, let's say you make $1 million in your business taxes or whatever. And for us, it's an S corp. You make $1 million, a year grossing. But when you do pay on that profit line, let's say that profit line is only 20,000 or whatever case, after all your deductions, expenses, etc. So it's only 20,000 that's returned back to you. That's the number that we're talking about for the threshold. So it's not the gross amount. It's that personal amount after all your deductions and expenses. So we wanted to kind of just take time to highlight that because I know that was one of our biggest fears is once we walk away from our 9-to-5 jobs is how we're going to have coverage when it comes to insurance. If I need to have regular checkups and things of that nature, because that was one of my fears. I'm like, okay, I walk away from my job and I go out here and get into a car accident, or I have heart attack or a stroke, something major like that, that costs hundreds of thousands of dollars. I need coverage to be able to cover that. It's all the way down to your basic things when you have your annual checkup, and co-pays. You know what out there that is coverage for entrepreneurs and people that are working independently. So that's where you want to go. It's
There
like
are
she said,
options.
there are options. So get with us. Like I said, we're always doing coaching and consulting, but get with us and we can kind of help you with that marketplace and applying for that for you and your business if you're independent. So
Yeah. Appreciate it. Any questions? Like Kurt said, you guys know where to find us: Facebook, social media, Instagram, kurt-wilson.com. And, we're here to answer any questions that you might have if we can. And if not, I'll help you find the answer. So that's